Over the weekend, I had cause to spend some time at St. Jude's Hospital, or should I say, the stadium in Vieux-Fort. And after 2 days of back and forth, I experienced firsthand what thousands of St. Lucians go through on a daily basis at our medical institutions. It is very unfortunate that we are starting 2025 in a worse state than what we ended the year 2024 with. We have a government who currently has the record for the worst Minister of Health in the person of Moses Musa Jabatis. Musa, who was the Minister of Agriculture during his last tenure in government, was deemed the most incompetent Minister of Agriculture we ever had. He was credited with being known as the Black Sikatoka Minister and the one who allowed the demise of the banana industry due to Black Sikatoka disease, or what we commonly call leaf spot. And today, just like he killed agriculture or plants, the Prime Minister now allows him to be responsible for the deaths of thousands of St. Lucians due to his known incompetence. We saw that within days of being in government, the Labour Party removed all the legal protocols that was put in place by the previous administration to save the lives of St. Lucians due to the COVID-19 pandemic. And within a year, Musa allowed over 400 St. Lucians to die due to COVID-19. It must be noted that this was the time when many countries were in recovery mode and reopening their economies. In contrast, the United Workers' Party was able to manage the pandemic in its heights during 2020 to July 2021 with less than 180 deaths. Musa has shown that in addition to his incompetence, he does not care about the people in his own constituency of Vieux-Fort North who has voted for him in the last 4 consecutive elections. He remains mute as dogs and other stray animals mingle with them at the St. Jude's Hospital as sick patients. He remains mute while allegations of victimizations happen at the hospitals, both St. Jude's and OKEU. He remains mute when a young man sat in a wheelchair for over 24 hours with no attendance and then dies. He remains mute when a young man who sat in a wheelchair for over 24 hours with no attendance and then dies. He remained mute as the hospital operates with a manual generator, whilst a basic part costing less than $500 that is required to fix it has not been provided, and people die when Lucilec takes the electricity. He remains mute while all the senior medical officials have resigned from the hospitals due to the animal-like conditions at the hospitals and the lack of funds being made available to buy basic medications like Panadol, ibuprofen, and even paper for an EKG machine. He remains mute while the doctors complain that they have to spend their own money to purchase supplies and there are no reagents at the labs. And he remains mute as the hospital has, on 2 occasions, warned sick St. Lucians not to come to OKEU but to find alternatives. And so we ask, is this what St. Lucian deserves? Is this what we voted for? In a letter written by the Medical and Dental Association, read the conditions at OKEU, they indicated that never in the history of St. Lucia has the healthcare system been in such a bad state. We saw in a report commissioned by the SLP team of consultants with Mr. John Peters, a renowned engineer, as part of the team, indicating that majority of the structure of St. Jude's were at 70%. However, after 2 years and millions of dollars spent by Reno and over $200 million in loan funding from the Saudi, a new government report indicates that the hospital is now at 50%. My dear Saint Lucian, I ask, how is it possible that in 2022 the hospital was at 70%, but now in January of 2025 it is now at 50%? Did the report commissioned by the Labour Party with renowned engineers deliberately lie to the Saint Lucian public? Or did Miss Jade Brown and Mr. Silas Wilson in the interview lie to the public of Saint Lucia about the stage of completion to date? Somebody along the line is lying to the Saint Lucian public. Will the Prime Minister give us a breakdown of how much money has been spent by Reno in the first instance via direct award, and how much was the new contract under the Saudi funds? Will the Prime Minister tell us how much money to date has been spent by this Labour administration to administer Clorox and paint and complete the St. Jude's Hospital? The government, therefore, should be ashamed to rejoice over the handling of healthcare whilst hundreds of St. Lucians continue to die sitting in wheelchairs and ordinary chairs in the hallways of our main hospitals due to lack of basic medication, lack of nurses and doctors and other medical professionals, and overworked staff. I will end by reminding the Labour Party that their seeming hope that they will win the next elections if they just open St. Jude's is both ludicrous and far-fetching. Because St. Jude's will not reverse the deaths of many St. Lucians who have died due to the lack of proper management of healthcare in St. Lucia. St. Jude's will not change the fact that right now as we speak, we have sick people sitting on a chair for over 2 to 3 or even 4 days at OKEU while waiting for a bed. St. Jude's will not change the fact that we have no medicines at the hospital, no Panadol, no ibuprofen, and we cannot even do a basic scan to help save a life. St. Jude's is not going to change the fact that over 400 people died due to COVID-19 in 1 year of the SLP being in government due to them putting politics over people. St. Jude's will not change the fact that OKEU has told people to stay at home if they are sick and do not come to the hospital. Even in the midst of COVID-19, the United Workers' Party administrations never once turned away anyone from any of our hospitals. St. Jude's will not change the fact that St. Lucians do not have health insurance and they cannot pay for basic health services, so they stay at home and die because they do not have money to go and see a doctor. And St. Jude's will not save Labour because people have had enough, and it is time for Philip J. Pierre and Moses Musa Jean-Baptiste to go. I thank you.